Today we are going to discuss about acne and scars. To discuss more on this, today with us Dr. Soujanya. Dr. Soujanya, Advanced Dermatology and Cosmetic Surgeon Center, Jubilee Hills, Hyderabad. Doctor, what are the common causes of acne?
Acne or pimples is the most common problem that we face. Like 90% of our consultations would be like acne or the pimples. It starts from teenage to adolescence and adult acne. The causes of acne varies with the age and the thing. The most common cause of acne is a genetic factor, and number two, it is because of the climatic. We are in a topical climate because of the hot and humid climate, and because of the normal hormonal changes which happen in teenage and adolescence. And adult acne is because of the some hormonal issues in the body. So likewise, there are some medication which can precipitate acne, and some dietary habits can precipitate acne.
Doctor, how frequent is teenage acne?
Acne is very common in the teenagers in the current scenario. So I get many teenage kids with acne on their skin. Number one, because of the hormonal changes, what is happening, and number two is because of the dietary habits. Giving them a good skincare routine and advising them a good lifestyle habits will always help us with the teenage acne, and which plays an important role in their skin in future. So it is always better to advise our teenage kids to cleanse their face, moisturize their face, or hydrate their skin, and use a sunscreen and use an anti acne cream in the night.
Doctor, can we assess the cause of acne depending on the distribution?
Yes, we can definitely assess the cause of acne depending upon the distribution. Usually, the teenage acne, because of a normal basic hormonal changes, would be there on the T zone, the forehead, and the nose, and just the medial cheek. And the acne, which is adult acne, because of the hormonal changes, would be there on the chin. And the acne, which happens because of the scalp oiling, or like because when you are in the hot humid climates and all, would be mostly predominant on the forehead.
Doctor, how to avoid acne?
From your side, from the patient point of the view, how to avoid acne is by having a healthy habits. Cleansing your face twice to thrice a day, using a moisturizer, sunscreen, and if you have an acne prone skin, using a salicylic acid based night serums, and adequate intake of water, regular exercise, and a good dietary habits. These are the things what you can do from your side.
Doctor, what should be the skincare routine to avoid acne?
By cleansing your face twice to thrice a day with a salicylic acid based cleanser or a beta hydroxy acid based cleansers, moisturizing your skin with a water based moisturizers, using a good sunscreen which is water based, and using a salicylic acid night active routine.
Doctor, how to avoid the complication of acne to avoid scarring?
So, how to avoid the complications of acne? What complications do you expect with the acne? The number one, the complication what we can expect is the acne scarring. We can always treat acne with a medical management with a minimalistic cosmetic procedures or a very minimal amount of peels. But if you scar with acne, it takes number of sessions at and you can't make your scar to be zero. We can't disappear the scar. So it is always better to prevent or avoid scarring than treating the scarring after it forms. And how to avoid scarring is by consulting your dermatologist and getting your acne treated.
Doctor, what are the procedures that can be done to avoid scars?
So once you develop acne scars, number one, the creams can help you to some extent. The topical retinoids and benzoyl peroxide will help you with an acne scars to some extent. And then number two, you can consult your dermatologist. We offer number of procedures to treat these acne scars. We do something like microneedling RF, where the needles go inside, give the heat, the RF energy or the heat, which causes a collagen stimulation, which stimulates the wound healing capacity of the skin, which helps the scars to some extent. But you need to get a multiple sessions from 3 to 6 sessions once in 2 months to get rid of your acne scars. And an acne scars treatment depend upon what kind of scarring you have. There are 4 types of acne scars. You have an ice pick scars, you have a roll-on scars, you have a box scars, and you also have a hypertrophic scar. So what procedures we do for acne scars? I'm just telling you what we do, but customizing a treatment is more important according to the scarring type of the patient. So, what sort of scars they have, it is always better to be customized according to the patient. But we do number of procedures from chemical peels to microneedling RF. We also do a fractional CO2. We combine fractional CO2 with an erbium glass as we have a beautiful device like Alma Hybrid. And we also do subcision and number of procedures, but we customize it according to your grade of a scarring and type of the scarring.
Doctor, what is MNRF?
Microneedling radiofrequency or MNRF. It is a procedure which we do for acne scars and also for the skin sagging and wrinkles. In this particular procedures, the needles go inside and give the RF heat. The needles give a trauma which stimulates collagen, and also the RF heat stimulates collagen. The combined together with good effect on the scars and also on the wrinkles.
Doctor, can you explain about the fractional CO2?
As I already told, we do something called fractional CO2 laser or a fractional erbium glass laser to treat your acne scars and also for skin rejuvenation and resurfacing. In fractional CO2, it is a laser light which ablates the skin, which stimulates the collagen. So, which gives you a better results for the acne scars and textural improvement of your skin. And with our device Alma Hybrid, we can actually combine fractional CO2 and erbium glass, which penetrates much deeper, and you get a better results with a less downtime and less complication.
Doctor, what do you mean by truncal acne?
So acne on the front and back of the chest, on the shoulders, is commonly called as a truncal acne. 80% of the time, the acne on the face or the pimples on the face is associated with the truncal acne, but we often miss it, and even from the patient's perspective and also the doctor's point. So use a salicylic acid body wash. Once you apply a body wash, leave it on for a couple of minutes for allowing it to penetrate deeper and exfoliating further, and hydrate or moisturize the skin immediately after bath, which helps in skin barrier repair function. And use a salicylic acid night care and consult your dermatologist if your truncal acne persists and if it is associated with some other condition.
So we have covered all the questions related to acne and scars. If you have still doubts, kindly mention in the comment box.